I'm Dr. Todd Lefkowitz here at Lexington Plastic Surgery in Columbia, South Carolina. And today we have Amanda, one of our nurses here at Lexington Plastic Surgery. We're going to be performing a TCA peel, or trichloroacetic acid peel, for her face. This is a skin resurfacing procedure. And what we're going to be using today is a combination of 30%, 35%, and 25% concentration for TCA peel to try to get a nice result for her. So what Amanda's been doing now for the last 6 weeks, she's been doing a pre-peel regimen consistent of retin-A and hydroquinone and alternating between those two. That does a couple things for us. Number one is it really kind of gets the skin ready for the peel. It helps cell turnover, and I believe it actually will help her heal a little bit faster on the back end of this procedure. In addition, one of the things that you always look for is for pigmentation changes after the peel. And what this pre-peel regimen will do, which will also put her on after this procedure, is it helps even out her skin tone. So with that said, what we're going to do is we're going to plan on doing a 30% on the forehead, cheeks here. We'll do a 35% around the mouth, as that has a little bit thicker skin. We'll use the 30% on the forehead here. Everybody has a different way to do it. I prefer using Q-tips. This helps gauge the pressure for which to apply the TCA. And what will happen and what the expectation will be is about 90 seconds to 120 seconds after the initial application of what we're doing here, she'll start to have a white frost. And really that's our clinical endpoint, is the depth of the peel will correlate to what the frost ends up being. So we're finished with the right side of the face. We used 30% here. Here we used 35% here to here around the mouth, and then 25% under the eyelids. So obviously we have the treated side, the untreated side. This is an even white frost that we're going for. What we'll do then is move over to the other side and do the exact same thing. By the time we get done with this side, this frosting will start to lighten up towards more of a pink hue. And she'll be good to go after. With Amanda, she did fantastic. You can see actually she has a pretty even white frost, but even as we speak, this only took about 10 minutes, and in that time, the right side, the frost has actually started to fade away a little bit. So same thing will happen here on the left side in the next 15 to 20 minutes. And again, we'll put on some what we call Aquaphor ointment for her. She'll put that on 2 to 3 times a day for the next about 5 days. She could expect to crust in the next 3 to 5 days as well. After that, she'll heal pretty quickly, and after about 7 to 10 days, she'll be really fully healed. She can start to put on makeup, cover, things like that. And then after that, she could expect to have a little bit of residual called erythema or redness for another about 4 to 5 days, so a total about 2 weeks. But again, something that's usually fairly easily covered with makeup and other products. So how did you feel?
Good.
Good, awesome. Well, that's it for our demonstration today. Certainly, if you have any questions, please don't hesitate. Give us a call. Love to chat. Take care. Bye bye.